almost every patient who has been recommended a surgery by the spine surgeon, the first thought which comes to their mind is how can I avoid it? Today, let's discuss the reasons why patient wants to avoid spine surgery. Hi, I'm Dr. Amish Sharma at Neo Spine Clinic in Mumbai. So today, let's discuss the reasons why patient want to avoid spine surgery. Number one reason. The first and foremost reason because of which patients want to avoid spine surgery is a lot of patients who suffer from spinal problem. They get better over the period of time. Their symptoms resolve and they are able to get back to their normal life. They can carry out their day-to-day routine. Every patient feel that probably they also fall into this category of the patients who will get better over the period of time. Even if the patient has a substantial problem in the spine, it may not necessarily be reflecting in terms of their symptoms. Many times there is a mismatch between the patient's symptoms and the magnitude of the problem on their MRI or X-ray. With the passing time, the inflammation in the spine subsides. The disc which had come out might shrink and cause less pressure on the spinal nerve. Patient also might get adjusted to this new normal where some amount of pain will be there. Because of all these factors, with the help of medications and physiotherapy, more than 80 to 90% of the patient's symptoms can be controlled. And every patient wishes that he or she will fall into this category of the patient who will get better without surgery. We always recommend a conservative non-surgical treatment to all the patients first, unless there are emergency symptoms like loss of power in the legs, loss of sensation, or bowel or bladder involvement, or loss of ability to control urine. And majority of these patients, they do get better with time, though the problem on the MRI and X-ray will give us clue about the cause of the patient's symptoms, but we don't treat X-ray or MRI, we treat the patient. As long as patient get better, their symptoms are resolved, we are done. We do not have to think about what's there in the MRI or X-ray. We might have to take some precautions to prevent future aggravation of the same problem. But if patient is able to carry on their day-to-day activities, they are able to get back to their job, that's the end of the story. We do not have to go for surgery. So that was the first reason that patients hope that maybe they will fall into this category of the patient where symptoms resolve over the period of time. The second reason of patients wanting to avoid spine surgery is that they've seen a lot of patients who had undergone spine surgery, but they are still affected to some or the other extent. They did not become normal. In fact, some of the patients did not get better at all. And what's the reason behind that? Even after removing the culprit pathology after doing the surgery, a lot of patients come at a very late stage. Their nerves are already damaged. They have been chronically centrally sensitized to have pain. They got this habit of feeling the pain all the time. So even after a well done surgery, some amount of symptoms will still keep on troubling them, and that becomes a source of doubt in the mind of the patient that even if I undergo surgery, will I really get better? In a well selected patient where there is a clear problem on the MRI or X-ray, where the patient's symptoms are matching with the problem shown on the imaging, and there is a clear surgical indication which has a good track record of treating this pathology and giving the patient results. If we follow these principles, then almost every patient who undergoes spine surgery becomes symptom free. They may not become 100% normal, but they definitely become significantly better, and they do feel the difference in pre-surgery and post-surgery status. The third cause of patients wanting to avoid spine surgery is the fear of necessity of long bed rest and activity restrictions after the spine surgery. It is true that some amount of precaution is required after the spine surgery in terms of no lifting heavy weight, no bending forward, no sitting on the floor, in cases of neck, no looking down for a long time. But these restrictions are temporary. Once the surgical area is healed, and in cases of fusion, the fusion has taken place at the operative site, patients are allowed to do unrestricted activity. In fact, patients can go back to sports activities also once their surgery is healed. In the current era, patients are able to sit, stand, walk on the same day or the day after the surgery. Some amount of activity restriction is required for few weeks, but most of the day-to-day activities are allowed. In fact, an office-going person can resume their work within 4 or 5 days after most of the minimally invasive spine surgeries. Fourth reason is the fear of complications after the spine surgery. Like any other surgery, spine surgery also have its own set of complications. The main fear in the mind of the patient is of paralysis. With a routine spine surgery, paralysis is almost non-existent. For a high-risk surgery where we have to deal with the spinal cord or the spinal nerve significantly, or if you are doing a big deformity correction where the spinal cord might get stretched and can cause weakness in the arms or legs, we use a newer modality called neuromonitoring. Neuromonitoring gives us feedback during the surgery itself about the function of the spinal cord and spinal nerve and let us know if some irritation is happening on the neural structures. If any surgical step has a possibility of affecting the neural structure, the neuromonitoring will tell us and we can take a step back. And this is how the risk of paralysis even for a high risk surgery or a big deformity correction also has become a rarity. Other complications like infection, feeling pain at the surgical site are same like it is for any other surgery. The fifth reason because of which patients want to avoid spine surgery is fear of future problems. Spine is not a singular structure, it's made up of multiple joints. There are a lot of vertebrae stacked one on top of each other, and in between the vertebrae there is a disc. If we do a decompression surgery in which we remove the disc or we remove the pressure on the neural structure, because of the continuous motion of the spine, patients can have recurrence of a disc prolapse or spinal stenosis at the same level. In cases of fusion surgeries, where the probability of having the problem at the same level goes down drastically, still patient might have new problem at the level higher or level below. Unfortunately, with these new problems, patient will have the same symptoms which they had before their initial surgery, and they will take it as failure of the first surgery, which is not true. Because of the dynamic nature of the spine, spine gives flexibility and support to the body. New problems might occur at the same level or at the levels adjacent to previous surgical area. Even if these problems happen, they can be very well taken care of. In fact, revision spine surgery in the current era is very common and the results are almost as good as the primary spine surgery. So even though every spine patient wants to avoid spine surgery, and we as a spine specialist also always put the patient on non-surgical treatment first. A patient who really needs spine surgery and who has failed conservative treatment or who has emergency symptoms should not skip spine surgery just because of unnecessary fear of spine surgery. In fact, delaying a required spine surgery will give poor results in the future. Please share this video with somebody you know who is suffering from a spinal problem and is just trying to avoid the spine surgery because of their unnecessary fear. And please comment below if you have any question. We'll be happy to help.